Yeah, traditional rescue inhalers, as I mentioned, are just a bronchodilator, so they just have the albuterol component, whereas the newer rescue treatments that have anti-inflammatory components have both the albuterol and the anti-inflammatory. So it's that combination, that kind of dual approach that has been shown to treat asthma exacerbations better than the traditional route. So there's been a shift in how we approach rescue in our asthmatic patients for the better. So a better efficacious approach in this situation, which is great because there's been a lot of advances in the asthma space over the last decade or so. This is one of many. There's been a lot of advancements on the control side. So some people with asthma will use daily controllers to help improve their asthma, but
Hmm.
this is specifically referring to that rescue approach. So there's good news for asthmatics on both sides of the coin, better controller therapies, better rescue therapies. And so we're in a really good space. So that's why it's so important. And that's why we're partnering with AstraZeneca right now to really work towards raising awareness during asthma peak week and approaching that proactive approach, really talking to your doctor and understanding what are the best treatment options for me right now.
Hey everyone, this is Jonathan Marx from GoToHealth. Hope you're having a beautiful day. For those 22 million adults living with asthma, the fall season is seen as a high-risk moment in time due to the heightened exposure of seasonal triggers such as mold and pollen, and the increased risk of an asthma attack. The third week of September, better known as peak week, is when asthma attacks and hospitalizations tend to spike to its highest peak, thereby serving as an important reminder of how dangerous the fall season can be for the asthma community. Asthma is a chronic respiratory disease that requires a proper diagnosis and close care year-round. With millions of asthma attacks reported each year, now is the time to schedule an appointment with your doctor to discuss the best treatment option available to help you manage your asthma symptoms and reduce the risk of an attack. Remember, planning ahead is key. With us to talk about this today is Dr. Justin Greiwe. He's a board-certified allergist and immunologist practicing in Ohio and completed his fellowship in adult and pediatric allergy and clinical immunology at the Cleveland Clinic. If you like what you're hearing today, do us a favor, please, and give us a like or five-star review on YouTube, Apple, or Spotify, or wherever you're listening to us. It helps other people find the show. Thanks in advance. So, welcome to the show, Dr. Justin Greiwe. How are you today?
Great. Thanks for having me.
Good. So, why is fall considered peak asthma season? What do experts consider this season to be such a dangerous time for the asthma community?
So really, we consider August through December to be a critical time of year for the asthma community in the US due to the heightened exposure to seasonal allergy triggers and then increased risk for asthma attacks during this time frame. In particular, the third week of September is what many call the peak or asthma peak week. That's when emergency room visits and hospitalizations for asthma tend to be the highest of the year. So it's really important that patients are educated that this time of year is more concerning and there's much greater risk for flare-ups during this time frame. In that same vein, each fall, the Asthma and Allergy Foundation of America publishes its annual Asthma Capitals Report. And this report ranks the 100 largest U.S. metro areas by how challenging they are to live in if you have asthma. So we'd encourage your readers and audience members to take a look at that and just get a better understanding of what are the potential triggers and how their area affects their asthma care and triggers. So it's important to understand.
Great. So, can you explain for us what is asthma and how does it differ from just regular allergies?
So asthma is specifically a disease of the lower airways, and it's often presents with shortness of breath, chest tightness, wheeze, cough, and these symptoms occur when the airways are inflamed or tight. So these two things really contribute to the symptoms that patients suffer from. And it's important to understand that the underlying inflammation that exists in the lower airways is really what drives disease. Now, inflammation can occur in the upper airways as well, and that's what people who have kind of seasonal or outdoor allergens deal with. They get
Hmm.
inflammation in the nasal passages, which causes congestion and running and dripping, sinus pressure. And so, that can also be something that asthmatics suffer from. They can have allergies and asthma at the same time. And so we oftentimes encourage patients to go to a board-certified allergist, immunologist, and get either skin or blood testing looking at what potential triggers might make them worse. So right now in the fall, ragweed and mold are big triggers,
Hmm.
but there's also triggers like tree pollens and grass pollen and dog and cat, dust mites. All these things can make asthma sufferers, asthmatics suffer more. So that's kind of where allergies and asthma overlap a little bit.
Great. And is asthma, does it usually have a childhood onset or can you develop it later in life?
Asthma can rear its ugly head anytime. More often it occurs in childhood, and then you continue to have that as you get into adulthood. Some kids will have severe asthma or mild asthma as child, and then slowly outgrow that, or it'll improve with time. But
Hmm.
some patients will have moderate to severe asthma their whole lives. So it really kind of depends on the person and presentation. It's a really common disease. About 22 million adults in the US live with
Wow.
asthma. And every year, about 9 million asthma attacks occur with over 700,000 ER visits. So this is a pretty ubiquitous condition that affects a lot of people in the US. And so that's where this education is so important. And that's why we're partnering with AstraZeneca right now to really raise awareness during this peak week for asthma, with the idea of really being proactive about all this. So encouraging your audience members with asthma to talk to their doctors now, review their treatment plans, and make sure they know what to do before the fall seasonal triggers come out so they can reduce the risk for an attack.
Good suggestion. So it's about talking to your doctor now before the bad asthma attack happens.
For sure.
Good. So people can learn more. I want to ask more questions, but people can learn more if you go to modernageofrescue.com and you'll learn more about asthma and the medications for that. Doctor, what are the warning signs that people should be aware of to consider when they should go to the hospital? I mean, how bad does this have to get before you should really consider going straight to the hospital?
Yeah, so it's important, as we mentioned, to talk to your doctor and develop an asthma treatment plan. And usually, when
Okay.
you have that asthma action plan, you'll have a kind of a set plan in place to know when this happens, this is when I do my rescue. When this happens, this is when I call 911 or go to the ER. And so it really is a conversation between the individual patient and their doctor. But for most patients, when we do have an asthma attack, the first thing patients will reach for is their rescue inhaler. And so traditional rescue inhalers were used and mainly treated that tightening of the airways we mentioned earlier.
Hmm.
And so when we gave a rescue inhaler that was a bronchodilator, it opened the airways up and provided some relief. But unfortunately, the traditional rescue inhalers didn't address that underlying inflammation. So over time, if you rely only on traditional inhalers, that can leave someone vulnerable to a future attack because you're not addressing the root problem, that inflammation that keeps on building up in the airways. And so myself and other global experts are increasingly recommending what's called an anti-inflammatory approach to asthma rescue. And that's where you're treating both the tightening and the inflammatory component of asthma, leading to better symptom control, less exacerbations. And so that's where that website, modernageofrescue.com, it really is great because it provides a lot of good information about what anti-inflammatory rescue is and how we can use it to prevent those hospitalizations, prevent those ER visits. But you know, if at any point the shortness of breath, the wheeze, the cough, the chest tightness becomes poorly responsive to rescue treatment, then definitely going to your physician or going to the emergency room is important because we want to address those flare-ups as quickly as possible.
Great. So this inhaler that you're talking about, I visited the website modernageofrescue.com. It's called AirSupra, and that's the dual action asthma inhaler that's FDA approved. Is that what you meant when you were talking about this dual action that it happened? It deals not only with the chest tightness, but also deals with the inflammation.
Yeah, traditional rescue inhalers, as I mentioned, are just a bronchodilator, so they just have the albuterol component, whereas the newer rescue treatments that have anti-inflammatory components have both the albuterol and the anti-inflammatory. So it's that combination, that kind of dual approach that has been shown to treat asthma exacerbations better than the traditional route. So there's been a shift in how we approach rescue in our asthmatic patients for the better. So a better efficacious approach in this situation, which is great because there's been a lot of advances in the asthma space over the last decade or so. This is one of many. There's been a lot of advancements on the control side. So some people with asthma will use daily controllers to help improve their asthma, but
Hmm.
this is specifically referring to that rescue approach. So there's good news for asthmatics on both sides of the coin, better control therapies, better rescue therapies. And so we're in a really good space. So that's why it's so important, and that's why we're partnering with AstraZeneca right now to really work towards raising awareness during Asthma Peak Week and approaching that proactive approach, really talking to your doctor and understanding what are the best treatment options for me right now.
Great. And in addition to planning with your doctor, what proactive steps can patients take to reduce the risk of an attack? Are there environmental things they can be aware of?
Yeah, I mean, definitely trying to control the environment to reduce exposure to those flares that cause exacerbations. So if you have issues with ragweed or mold during the fall season, closing the windows at the house, using the AC, leaving those windows up and when it's a beautiful fall day to
Mhm.
reduce the exposure to those fall allergens. Of course, with the school year starting and kids going back to school, they're bringing a lot of viruses and bacteria back into the home. Those are difficult situations because it's hard to avoid those exposures. But viruses and bacteria can be a trigger. Looking at pollen counts online, looking at what are the pollution counts. There's different ways in which you can measure air quality. So maybe if
Sure.
you're if you like to exercise outside, avoiding going out when the pollen count's really high or when the air quality is really poor. So there's little things you can do on a day-to-day basis to reduce your risk for an exacerbation. But ultimately, it's about better controlling your asthma with a relationship with either a primary care doctor or a board certified allergist, immunologist, or pulmonologist to really develop a plan so that we can prevent all these symptoms from recurring in the first place with a good treatment approach.
Good. So, one question I always like to ask when I don't have any more is what question should I have asked that I haven't asked yet? Or what message would you like to leave with people today?
Yeah, I think just given how many patients suffer from this condition, as we mentioned, the 22 million adults in the US, it's a lot of people. And I think that getting access to care is really important. So making sure people are educated on what asthma is, what resources are available for them. So we mentioned some of the sites earlier. There's the Modern Age of Rescue.com. There's the American College of Allergy Immunology. There's the American Academy. All these are great physician-vetted resources with great information, great educational content, so people can go to these sites, read up about their disease, and also go to a specialist so they can get diagnosed in the first place. Some people might not know they have asthma, have some of these symptoms, and say, man, I should see someone to find out if this is truly asthma. So talking with your primary care doctor to see if you can get a referral. Not everything that wheezes or coughs is asthma, so it's important to make sure we get the right diagnosis the first time and get you on the appropriate treatment. So all these things can be helpful as we look towards allowing people with asthma to have a happy and healthy fall season.
Great. Thanks so much for being with us today, Doctor.
Of course, it was a pleasure. Thanks for having me.
Good. We've been talking with Dr. Justin Greiwe. He's a board certified allergist and immunologist practicing in Ohio. He's been on with us to talk about Fall Peak Week, which is referring to the asthma season and is encouraging people to consult with their doctors so that we can avoid asthma attacks and hospitalizations. Thanks again for being with us, Doctor. It's been very helpful. Before we go, just a quick reminder, if you liked what you've heard, please leave us a 5-star review on Apple or Spotify or YouTube, wherever you're listening to us. It helps keep this content free and reaching the right people just like you. This has been Jonathan Marx with GoToHealth, and as we say at the end of every show, go to health. Take care. We'll see you again next time. Bye. Thank you for tuning in today to Go to Health. You are one of almost 10,000 people per day who enjoy the evidence-based health information offered by our guest health experts. You can watch us on our website and YouTube and listen to us on 8 podcast networks. Be sure to join Jonathan Marx in our upcoming shows each week. If you like our show, please share this episode with your friends and colleagues. You can subscribe to the show, join our email list, send us feedback, browse through the online store, and view our library of over 150 shows at gotohealthmedia.com. See you next time, and remember to elevate your life with Go to Health.